Testosterone and sperm production. Testosterone replacement therapy. In this video, I'm going to talk about how testosterone might affect your sperm production. I'm called GERALD MASSA and I'm a global fertility coach. I can answer all your questions related to fertility, related to men's health. So, when you start on testosterone therapy, there's going to be changes that could actually take place. These changes could actually be connected with the normal functioning of your hormonal system. One thing you have to take from this video is that in most cases, when you look at the brain of a man, there's that small part known as the anterior pituitary gland. This small part, also known as the anterior pituitary gland specifically, it produces two hormones. There's a hormone known as the follicle stimulating hormone, and then of course there's also the other hormone known as the luteinizing hormone. In summary, FSH and LH hormones are produced by the anterior pituitary gland, small part in the brain. Now, you might ask yourself, what is the function of these two hormones? We shall begin with FSH. When FSH has been produced, it travels in the bloodstream, in the blood of a man, and then it goes to the testes. Specifically, the testes or testicles, that's where the whole process of sperm production takes place. Specifically, the area where the sperms are produced is in a small part in the testes known as the seminiferous tubules. The cells which deal with this whole process of sperm production are known as the Sertoli cells. So, the Sertoli cells respond to the effects of the FSH hormone that came from the brain. Now, for normal sperm production, FSH has to come in and then bring about this whole process of sperm production. And then, of course, there's going to be another hormone that is going to be produced. I've talked about it. It's known as the luteinizing hormone. When it reaches a man's testes, specifically, it acts on the cells known as the Leydig cells, causing or leading to the production of more testosterone. Ideally, in a man, testosterone is produced normally in the Leydig cells, special cells in your testes, or your testicles. If you go ahead and then you consider starting, or you go ahead and you start on replacing the testosterone, also known as testosterone replacement therapy, whereby you could actually get injections of testosterone. These could actually be prescribed to you, given to you by your doctor. The effects that are going to happen are that there's going to be changes that will take place in the centers where FSH and LH is produced. Remember, I was saying in the beginning that the brain specifically sends FSH and LH to your testicles as a man, and then FSH and LH will do this function, will carry out this function of sperm production, and then of course maintain your testosterone levels. Okay, if you go ahead and then you get sources of testosterone from outside, we call these exogenous sources of testosterone, injections of testosterone. It means that the artificial testosterone, the synthetic testosterone you are injecting yourself with, could actually tell your body, tell your brain, and then your brain will be able to sense that, you know what, there's more testosterone coming in from the outside. Now, when the brain senses that there's lots of testosterone coming in from the outside, the brain will actually cause FSH and LH hormone to actually reduce. It will stop the production of FSH and LH in your body. Now, when FSH and LH has been stopped or has been reduced, then it means that your testicles, remember your testicles respond to FSH and LH. So if the FSH and the LH is not coming in naturally from your brain due to the excess or due to the external testosterone you are injecting yourself with, then there's going to be reduced sperm production. There's going to be a reduction in the normal testosterone you were born with. So the basic or the most significant point you need to take from this video is that when you inject yourself with testosterone injections, there's going to be a shutdown, or there's going to be a reduction in the normal production of the FSH and LH hormones which you were born with. And when these hormones have been reduced, then you could actually end up with low sperm counts. Low sperm count specifically directly correlates with infertility. You could actually have difficulties making your wife pregnant due to the injections of testosterone you have started on. So before you start on testosterone injections, before you start on testosterone replacement therapy, TRT for testosterone, okay, replacement therapy, before you start on that treatment, it's actually very wise, it's very advisable that you discuss with your doctor, you discuss with your physician, you discuss with your reproductive endocrinologist, and then they could actually give you options on how you could actually preserve your sperms before starting on the testosterone replacement therapy. Because once you start on it, then at the same time, you maybe later on in future you want to have children, and yet you are already on testosterone, FSH and LH has been shut down, sperm production have been actually affected. It could actually not be a good idea. So it's always very good for you to discuss with your doctor before you start on testosterone replacement therapy. If you are to take one point from this video, take this point that before you start on testosterone replacement therapy, it's very important for you to discuss with your doctor, and then of course look at ways on which your sperms could actually be preserved. Sperm preservation can be done, and then maybe later on when you want to have children, you can always go back and then through procedures known as IVF, in vitro fertilization, or other assisted reproductive technologies like maybe ICSI, then this can actually be initiated, your sperms can actually be brought back, and then you can actually have children. So testosterone replacement therapy was the name of the video. Let me answer all your questions in the comments below. If you have any questions, kindly ask your questions in the comments below. I'll be able to answer. I'm called GERALD MASSA, and I'm a global fertility coach. I can answer all your questions about fertility. I can answer all your questions about ultrasound scans. I can answer all your questions about reproductive health. Let me see you in the next video. Have yourself a fantastic day, and thanks for watching today's video lesson about testosterone replacement therapy. Bye bye.